another thing that we do with a lot of patients is it's amazing how unsafe patients feel in their bodies. And again, I never used to sort of ask about this. And we often will say to people, whereabouts in your body do you feel comfortable? Whereabouts in your body do you feel comfortable? And people will often kind of, they think about it for a moment, and then they're like, I don't think I feel comfortable anywhere in my body. And that is, they're essentially walking around in a body, in a vessel that actually feels safe. And so again, teaching that sense of safety within the body is really important. And so what we will do then is we do a embodied technique where we teach people to try and find a place within their body that is comfortable. So we say, listen, just scan through your body if you can and find a place that does feels okay to be in. And often it's an extremity if people are very, very anxious. It might be a foot, or it might be the lower legs. And we then say to them, okay, just describe to me the sensations that you're getting in there. Tell me how you feel when you're hanging out in your right foot. And they'll go, oh no, it feels okay in my right foot. I feel okay there. So that's great. And does it feel warm or cold? And they'll have it, think about it, and they'll say, well, then actually it feels quite warm. And does it feel sort of safe? Do you feel secure if you're sitting in your right foot? And they'll say, yeah, no, I'm okay there. So it's all right to be there. And essentially what that does is you then say, okay, that's great. Well, just hang out there for a minute. What I want you to do is just hang out there for a minute. And then I want you to tell me how that makes you feel. And people often then will say, oh, okay, I feel, yeah, no, that feels okay. I feel quite relaxed when I hang out in my foot. And we say, brilliant, that's great. Just remember that feeling. You can always go back to that feeling. And again, it's the beginning of teaching somebody the safety to be in their own body. And later on, again, what we would then do is we then, when we've got a place of safety, we'll then go on to say, okay, now let's just have a little look at the area of your body that's uncomfortable. So we might what we call pendulate between the area that feels comfortable and the area that feels uncomfortable. And we'll say, well, just go and have a little look at the bit that's uncomfortable, perhaps their low back. And then you can when they're here or online, you can see that they don't feel comfortable and they feel a bit anxious about it. So we say, that's fine. Let's just pop back to your foot. And we might, sort of pendulate between the two areas until the point at which they can go, oh no, I can feel that. I can feel into my low back now. I'm not so scared of it. And as I say, that's part of that sort of somatic tracking, that being able to look at it with curiosity and feel it and know that while sensations are uncomfortable, they're not dangerous. And we get people to then do that every time they feel their pain when they're at home as well. So just feel your pain, just let yourself know that you're okay, lots of reassurance. And it then starts to rewire the program so that it basically changes the way that they respond to pain. And then we can change the pattern.